The fluorescent lights of UCSF Medical Center hummed softly as 86-year-old Mansfield Doy lay on the examination table, his weathered hands trembling slightly. Not from fear, but from the pain that had been his constant companion for months. His bile ducts, those tiny pathways that should carry digestive fluids smoothly, had become narrow and blocked, turning his golden years into a nightmare of discomfort and uncertainty. Dr. Kim stood beside him, his keen eyes studying the latest ERCP results with the intensity of a detective solving a crucial case. Known throughout the hospital as Dr. Miracle for his lightning-fast surgical hands and uncanny ability to see hope where others saw only complications, Dr. Kim had earned his reputation by never giving up on patients, regardless of their age or condition. "Mr. Doy," Dr. Kim said softly, his voice carrying the weight of years spent delivering both devastating news and miraculous recoveries. "The repeated ERCP procedures haven't given us the results we hoped for. Your bile ducts are still severely narrowed." Mansfield's daughter squeezed her father's hand, her eyes reflecting the same mixture of hope and terror that Dr. Kim had seen in countless families over the years. At 86, most surgeons would consider Mansfield too high risk for major surgery. The conventional wisdom would be to manage his pain and accept a diminished quality of life. But Dr. Kim wasn't most surgeons. He saw beyond the numbers on the chart, beyond the age written in bold letters at the top of the medical record. He saw a man who deserved to live his remaining years with dignity, without the constant shadow of pain and limitation. "However," Dr. Kim continued, his eyes lighting up with the spark that his colleagues had learned to recognize as the moment when the impossible became possible, "there's something new we can try. Something that approaches your care not just as a surgical case, but as a complete healing journey for you and your entire family." The room fell silent except for the gentle beeping of monitors and the distant sounds of hospital life. This was the moment that would change everything, not just for Mansfield, but for everyone who would witness what was about to unfold. In medicine, they say there are no miracles, only science and skill working in perfect harmony. But sometimes when everything aligns, the right doctor, the right patient, the right moment, something magical happens that transcends the boundaries of what we thought possible. This is one of those stories. Dr. Kim's office was different from the typical sterile medical consultation rooms. Warm lighting replaced harsh fluorescence, comfortable chairs invited conversation rather than interrogation, and family photos on his desk reminded visitors that healing was about more than just fixing bodies. It was about preserving the connections that make life worth living. When Mansfield and his daughter entered for their consultation, they carried the weight of months spent navigating a medical maze. ERCP after ERCP had failed to provide lasting relief. Each procedure brought temporary hope followed by the crushing disappointment of recurring symptoms. The family had begun to accept that this might be how Mansfield's story would end. Not with peaceful golden years, but with gradual decline and increasing dependence. Dr. Kim studied Mansfield's medical history with the thoroughness of a scholar and the compassion of a father. Every lab result, every imaging study, every failed procedure told part of Mansfield's story. But Dr. Kim was reading between the lines, seeing the man behind the medical record. "Tell me about your life before this started," Dr. Kim asked, setting aside the thick folder of test results. This question surprised the family. Most doctors focused only on symptoms and test results, rarely asking about the person experiencing the illness. Mansfield's eyes brightened as he spoke about his independence, his daily walks, his enjoyment of simple pleasures that had been stolen by his condition. His daughter watched her father transform before her eyes, remembering the vibrant man he had been before illness began defining his existence. "I can perform the surgery you need," Dr. Kim said finally, his words carrying both confidence and careful consideration. "But surgery alone isn't enough for someone in your situation. What you need is something we've recently developed here, a comprehensive approach that treats not just the medical problem, but prepares you and your family for every aspect of recovery." He explained the Surgery Wellness Program, a revolutionary approach that recognized surgery as just one component of healing. For older patients especially, success depended on nutrition, physical therapy, emotional support, and family involvement working together like instruments in an orchestra. You'll be assigned a health coach, a registered nurse who will be your guide through this entire journey. She'll coordinate with every specialist, anticipate challenges before they become problems, and ensure that you and your family understand each step of the process. The concept was foreign to Mansfield's daughter, who who had grown accustomed to fragmented care, seeing one specialist for digestive issues, another for age-related concerns, each treating their piece of her father without seeing the whole person. Dr. Kim leaned forward, his expression serious but hopeful. "I won't lie to you. At 86, this surgery carries risks that wouldn't exist for a younger patient. But I've seen what happens when we combine surgical precision with comprehensive care. I've seen patients your age not just survive, but thrive." Diana Tung, RN, had the kind of presence that immediately put families at ease. Her warm smile and confident manner conveyed both professional competence and genuine caring. As Mansfield's assigned health coach, she would be the constant thread connecting all aspects of his care, ensuring nothing fell through the cracks that often exist between medical specialties. "Think of me as your medical translator and advocate," Diana explained during their first meeting. "I'll help you understand what each specialist is saying, coordinate your appointments, and make sure everyone on your care team is communicating with each other." Mansfield's daughter felt a wave of relief. For months, she had felt lost in medical jargon and conflicting advice from different specialists. Having one person who could see the big picture and guide them through the complexity felt like being thrown a lifeline in turbulent waters. Diana began by conducting a comprehensive assessment that went far beyond Mansfield's immediate medical needs. She evaluated his home environment, his support system, his nutritional status, and his physical capabilities. This holistic approach revealed factors that could impact his recovery. Things that might never appear on a traditional medical chart, but could make the difference between success and complication. "Your father's overall health is actually quite good for his age," Diana told the family after completing her evaluation. "His heart is strong, his cognitive function is excellent, and he has a robust support system. These are all factors that work in his favor." But Diana also identified potential challenges. Mansfield's appetite had decreased due to his ongoing symptoms, affecting his nutritional status. His activity level had declined as pain made movement uncomfortable, leading to some loss of muscle strength. These issues needed to be addressed before surgery to optimize his chances of a successful recovery. The preoperative phase became a carefully orchestrated preparation period. A nutritionist worked with Mansfield to improve his protein intake and overall nutritional status. A physical therapist designed gentle exercises to maintain and improve his strength. Diana coordinated with Dr. Kim's surgical team to ensure everyone understood the specific considerations for an 86-year-old patient. "Recovery from major surgery is like training for a marathon," Diana explained. "The better prepared you are going in, the better your chances of success. We're not just preparing your body for surgery, we're preparing your entire support system for the journey ahead." The family began to understand that they weren't just passive observers in Mansfield's care. They were active participants in a team effort that included medical professionals, family members, and Mansfield himself. Each person had a role to play in the success of his treatment and recovery. Dr. Kim visited regularly during this preparation phase, monitoring Mansfield's progress and adjusting the surgical plan as needed. His confidence in the approach was infectious, and the family began to feel hopeful in a way they hadn't experienced in months. The operating room doors closed behind them, but this was just the beginning of a journey that would test everyone's faith in the power of comprehensive, compassionate care. The operating room at UCSF was a temple of modern medicine, where Dr. Kim transformed from compassionate physician to surgical artist. His hands moved with the precision of a master craftsman, each movement calculated and purposeful. The complexity of Mansfield's case required not just technical skill, but the kind of intuitive understanding that comes from years of pushing the boundaries of what's possible. At 86, Mansfield's tissues were more delicate, his recovery capacity diminished, and the margin for error smaller than it would be for a younger patient. But Dr. Kim had built his reputation on cases others deemed impossible. He approached each surgical challenge like a complex puzzle, finding solutions that existed in the space between textbook procedures and innovative adaptation. The bile duct reconstruction required microscopic precision. Working through small incisions, Dr. Kim carefully removed the diseased tissue and created new pathways for bile flow. His surgical team, accustomed to his exacting standards and lightning-fast pace, moved in perfect synchronization, anticipating his needs before he voiced them. "Vital signs are stable," the anesthesiologist reported regularly, monitoring not just Mansfield's immediate surgical response, but the subtle indicators that could predict post-operative complications in elderly patients. Diana remained in close contact with the family during the surgery, providing regular updates and emotional support. She understood that waiting was often the hardest part for families, and her presence provided reassurance that Mansfield was receiving the best possible care. The surgery took longer than initially estimated, but Dr. Kim refused to compromise thoroughness for speed. He methodically addressed each aspect of Mansfield's condition, ensuring that the repair would be durable enough to last for the rest of his patient's life. The technical aspects went beautifully, Dr. Kim told the family afterward, his scrub still bearing traces of the intense focus required for the procedure. The reconstruction is solid, and his body tolerated the surgery remarkably well. But now the real work begins. This statement puzzled the family initially. They had assumed that successful surgery meant the hardest part was over. But Dr. Kim and Diana understood that for an 86-year-old patient, surgery was just the first step in a complex recovery process that would test every aspect of the comprehensive care approach they had designed. The immediate post-operative period went smoothly. Mansfield awakened from anesthesia alert and responsive, his vital signs stable, and his pain well controlled. The family felt a surge of optimism, believing they had successfully navigated the biggest challenge. But medicine, especially geriatric medicine, rarely follows a straight path from problem to solution. As Mansfield began his recovery, no one could predict the challenges that lay ahead. Challenges that would test not just his physical resilience, but the strength of the entire care team that had committed to his healing journey. The call came at 2 a.m., 3 days after surgery. Mansfield was experiencing complications that the medical team had hoped to avoid but had prepared for, because in geriatric surgery, preparation for the unexpected often makes the difference between recovery and tragedy. Dr. Kim arrived at the hospital within minutes, his mind already racing through the possible causes and solutions. Diana was already there, coordinating with the nursing staff and preparing to contact the family. This was exactly why the surgery wellness program existed, to ensure that when complications arose, the response was immediate, coordinated, and comprehensive. His digestive system is struggling to restart after the surgery, Dr. Kim explained to the concerned family. This isn't uncommon in patients his age, but it requires careful management to prevent more serious complications. What followed was a cascade of interconnected challenges that would have overwhelmed a less comprehensive care approach. Mansfield's digestive issues led to nutritional concerns. His extended bed rest increased the risk of blood clots and pneumonia. His medications required constant adjustment to balance pain control with mental clarity. But this was where the surgery wellness program showed its true value. Instead of each complication being treated in isolation by different specialists, Diana coordinated a unified response that addressed all of Mansfield's needs simultaneously. The nutritionist worked closely with the gastroenterologist to find ways to maintain Mansfield's nutrition despite his digestive challenges. The physical therapist developed bed exercises to maintain circulation and prevent muscle loss. The pharmacist collaborated with Dr. Kim to optimize medications for an elderly patient dealing with multiple simultaneous issues. "This is exactly what we prepared for," Diana told the worried family. "Complications in elderly patients often come in clusters, but we have protocols for managing each one while supporting his overall recovery." Dr. Kim made multiple daily visits, his trained eyes detecting subtle changes that could indicate improving or worsening conditions. His hands, so steady and precise in surgery, were equally gentle during examinations, checking incision sites, listening to lung sounds, and assessing neurological function. The family watched this orchestrated response with amazement and growing confidence. Instead of feeling helpless in the face of mounting complications, they saw a team working together with purpose and expertise. "Every patient's recovery journey is unique," Dr. Kim explained during one of his visits. "We can't always prevent complications, but we can respond to them quickly and effectively. Your father's body is working hard to heal, and we're supporting that process every step of the way." Slowly, incrementally, Mansfield began to improve. Each small victory, tolerating clear liquids, sitting up without dizziness, taking a few steps with assistance, was celebrated by the entire care team as progress toward the ultimate goal of independent living. The complications that seemed overwhelming at first were becoming stepping stones in Mansfield's recovery. Each challenge met with expertise, compassion, an unwavering commitment to his healing. 2 weeks into his recovery, Mansfield faced what Diana privately considered the most critical phase of his journey. The initial surgical trauma had passed, the immediate complications were stabilizing, but now came the challenge that determined whether elderly patients truly recovered or merely survived: the transition from medical support to independent function. Dr. Kim understood this critical juncture better than most surgeons. He had seen too many technically successful surgeries fail during recovery because the comprehensive support needed for elderly patients simply didn't exist in traditional medical systems. The Surgery Wellness Program was designed specifically to bridge this gap. Recovery isn't just about healing from surgery, Dr. Kim explained to a group of medical students who were observing Mansfield's case. For older patients, it's about rebuilding confidence, strength, and independence while managing multiple body systems that are all trying to return to baseline function simultaneously. Diana orchestrated this complex process like a conductor leading a symphony. Physical therapy sessions were scheduled when Mansfield's energy levels were highest. Nutritional support was provided when his digestive system was most receptive. Family education occurred when everyone was present and emotionally ready to absorb important information. The physical therapist, Sarah, worked with Mansfield daily, but her approach was different from standard post-operative care. She understood that at 86, Mansfield wasn't just recovering from surgery. He was fighting against the natural decline that occurs when illness disrupts normal activity patterns. "We're not just getting you back to where you were," Sarah told Mansfield during one particularly challenging session. "We're building you up stronger than you've been in years." The nutrition team faced their own unique challenges. Mansfield's appetite remained poor, a common issue in elderly post-surgical patients. But instead of simply providing standard dietary recommendations, they worked with his family to identify foods that held positive memories and associations, making nutrition part of emotional healing as well as physical recovery. Dr. Kim made his daily rounds not just to check medical progress, but to assess the less tangible aspects of recovery: Mansfield's spirits, his engagement with the process, his confidence in his own abilities. These psychological factors often determine the ultimate success or failure of recovery in elderly patients. "Your father is stronger than he realizes," Dr. Kim told the family one afternoon. "The surgery was successful, the complications are resolving, but most importantly, his spirit remains strong." That's often the most important factor in recovery. The comprehensive approach began to show its true benefits as Mansfield's various body systems started working together more effectively. His improved nutrition supported his physical therapy efforts. His increased mobility aided his digestive recovery. His growing confidence motivated him to participate more actively in his care. Diana documented each aspect of his progress, not just for medical records, but to show other families that comprehensive recovery was possible even in challenging cases. As Mansfield's strength returned day by day, everyone involved in his care began to see the true power of treating not just a surgical case, but a whole person with hopes, dreams, and the desire to live independently once again. The moment Mansfield took his first unassisted steps down the hospital corridor marked a turning point that everyone had hoped for, but no one had dared to expect with complete confidence. Dr. Kim watched from the nurse's station, his usually composed expression breaking into a smile that reflected months of careful planning, skillful surgery, and comprehensive care finally coming together. "Look at him go," whispered one of the nurses who had been involved in Mansfield's care from the beginning. It wasn't just the physical achievement of walking that impressed the staff. It was the determination in his stride, the straightness of his posture, and the spark in his eyes that had been dimmed by months of illness, but was now burning brightly again. Diana walked beside Mansfield, not providing physical support, but offering the emotional encouragement that had become her hallmark throughout his recovery. Her role was evolving from medical coordinator to cheerleader, helping Mansfield recognize and celebrate each milestone in his journey back to independence. The discharge planning process began in earnest, but it wasn't the typical hurried preparation that often characterizes hospital discharges. The Surgery Wellness Program approach meant that Mansfield's transition home was as carefully orchestrated as his surgery and recovery had been. Dr. Kim spent extra time with the family, explaining not just the medical aspects of ongoing care, but helping them understand what to expect in the weeks and months ahead. His experience with elderly post-surgical patients allowed him to prepare them for the normal ups and downs of recovery, distinguishing between concerning symptoms that required immediate attention and the typical fluctuations in energy and comfort that were part of the healing process. Recovery doesn't end when you leave the hospital, Dr. Kim explained. In many ways, that's when the most important phase begins. You'll continue to get stronger for months to come, but it requires patience and persistence. The home health team had already conducted a thorough assessment of Mansfield's living environment, identifying potential safety hazards and recommending modifications to support his recovery. Physical therapy would continue at home, with Sarah providing regular visits to ensure his strength and mobility continued to improve. Most importantly, Diana would maintain contact with the family during the crucial first weeks at home. Her phone number was programmed into their phones, and they knew she was available for questions, concerns, or simply reassurance during moments of uncertainty. The day of discharge arrived with a mixture of excitement and apprehension. Mansfield was eager to return home, but the family couldn't help feeling nervous about leaving the security of the hospital environment where expert help was always just a call button away. "You're ready for this," Dr. Kim told Mansfield during their final hospital consultation. "You've overcome every challenge we anticipated and some we didn't expect. Your body has healed beautifully, and your spirit is stronger than ever." As Mansfield walked out of UCSF Medical Center on his own legs, carrying himself with dignity and strength, everyone who had participated in his care felt the profound satisfaction that comes from making the impossible seem routine. 3 months after surgery, Mansfield stood in his own kitchen, preparing breakfast with steady hands and clear purpose. The simple act of making coffee and toast, tasks he had been unable to perform during the worst of his illness, represented a victory that transcended medical charts and surgical reports. Dr. Kim received regular updates on Mansfield's progress, each report confirming what the entire care team had dared to hope but had been careful not to promise. Not only had Mansfield recovered from major surgery at age 86, but he had regained a quality of life that many patients half his age would envy. Diana's follow-up calls revealed a man who was not just surviving but thriving. Mansfield had resumed his daily walks, was managing his own medications, and had regained his independence in all aspects of daily living. The comprehensive approach to his care had achieved exactly what it was designed to accomplish. The most rewarding part isn't just that the surgery was successful, Dr. Kim reflected during a team meeting where Mansfield's case was discussed as an example of optimal geriatric surgical care. It's that we gave him back his life, not just extended his survival. The surgery wellness program had proven its value through Mansfield's case, but more importantly, it had demonstrated that age alone should never determine a patient's treatment options. With proper preparation, comprehensive care, and unwavering commitment from the entire medical team, even complex surgical cases in very elderly patients could achieve outcomes that bordered on miraculous. Mansfield's daughter often reflected on the journey they had traveled together. What had begun as a frightening diagnosis with limited treatment options had become a story of hope, recovery, and renewed independence. The key had been finding medical professionals who saw beyond the numbers on a chart to the person underneath. "My father didn't just survive surgery at 86, she would tell friends who asked about his remarkable recovery. He came back stronger and more vibrant than he had been in years." It wasn't science fiction, it was science, skill, and compassion working together to create what can only be called a miracle. The success of Mansfield's case rippled through the medical center, inspiring other families facing similar challenges and encouraging medical professionals to consider comprehensive care approaches for their most complex patients. His story became part of the institutional memory, proof that with the right approach, age is just a number, not a limitation. Dr. Kim continued to receive updates on Mansfield's progress, each report bringing satisfaction and reinforcement of his belief that every patient deserves the chance to live their remaining years with dignity, independence, and hope. In the end, Mansfield's recovery proved that medicine at its best is not just about treating disease, but about restoring the human spirit and preserving the connections that make life worth living. Today, as we conclude this remarkable journey, Mansfield Doi continues to live independently. His daily walk's a testament to the power of comprehensive medical care that treats the whole person rather than just the disease. His story challenges everything we thought we knew about age limitations and surgical outcomes. Dr. Kim continues his practice at UCSF, carrying with him the lessons learned from Mansfield's case and applying them to other patients who might benefit from the surgery wellness program approach. Diana Tung remains a dedicated health coach, using Mansfield's success story to encourage other families facing similar challenges. The lesson from Mansfield's recovery is clear. When medical expertise combines with comprehensive care, family support, and unwavering determination, age becomes irrelevant. What matters is the commitment to seeing each patient as a whole person deserving of the highest quality care, regardless of the numbers on their birth certificate. If you or someone you love is facing a medical challenge that seems insurmountable, remember Mansfield's story. Seek out healthcare providers who see beyond diagnoses to the person underneath. Ask about comprehensive care approaches that address not just the medical problem, but the entire healing journey. Most importantly, never let age alone determine treatment options. In an era of advancing medical knowledge and improving surgical techniques, combined with comprehensive care approaches like the surgery wellness program, the impossible is becoming routine, and miracles are being redefined as simply excellent medicine applied with wisdom, skill, and compassion. Mansfield's story proves that it's not science fiction when an 86-year-old man walks again after major surgery. It's the beautiful reality of modern medicine at its very best.